100 of you in this room that were taking various medications. They would all be different. You'd be taking them at different times, different doses, and your side effect profile would also be hugely varied. When we look at potential, and I try to emphasize this in the office, capital P for potential, because you can go to a bottle of Tylenol or Advil, and there's a paragraph this long in the PDR potential side effects, but most people have little to none. And it's very similar with a lot of the medications that we use, but there are a lot of potential side effects. Yes, there are potential interactions with some of these medications, so you really have to be careful, and you need to see somebody like Dr. Kumar, who is a movement disorder specialist, who sees more patients with Parkinson's disease in a week than a general neurologist probably sees in a year or two, because he's much more familiar with the side effects and the interactions of all these medications. And I can take one more question.
You touched a little bit on the fetal tissue implant, and I'm wondering about adult stem cells.
Right. There it is, yes. So you can see that was conspicuously absent from my talk. I interrupted this. Go ahead.
Well, the reason I'm asking is because my husband and I were at a lecture with a neurologist who presented some studies on adult stem cells, and first of all, that they were effective. Second of all,
for what?
For treatment of Parkinson's.
Wow.
He
scooped federal government and the rest of the world.
Secondly, that if adult stem cells taken from the patient are implanted, that they are less likely to cause tumors because the tissue is recognized by the body.
Okay, so let me address that first, because that's a simple answer. Yeah, that would be ideal if you didn't have to take foreign tissue and implant it into somebody's brain. And you could actually isolate your own stem cells and modify them, put them back in your brain, and have them work effectively, not grow tumors. Now, it would be better from an immunologic standpoint to use your own cells. Will they not cause tumors? Nobody can answer that because we don't understand that technology yet. We don't know the simplest answer to the simplest questions of how many cells, where do you get these cells from, where do you implant them, how many do you implant, how do you prepare them? That, we just don't know the answers to. Those are the most basic issues, number one. Number two, the only FDA-approved therapy for stem cells that's experimentation currently is looking at regeneration of spinal cord damage in patients that have had significant spinal cord trauma. So that's the only study in this country that's going on in humans in a relatively large study. I have patients that go to Mexico, and they go over the border to Tijuana, and they get their own stem cells harvested with a whole bunch of other who knows what injected back into them. And what I tell them is that, they would be better off taking that money and doing anything else with it that might make them feel good. There's a huge placebo effect to any of these interventions. You have a vested interest in feeling better when you drop in $20,000. You have a vested interest in feeling better when you're having a surgical procedure, even a simple one. You want to feel better. But we don't know what the answers are until you have a sham surgical procedure and an interventional surgical procedure and compare the results. Right now, nobody has done human studies with stem cells in Parkinson's disease, and nobody has shown that stem cells are in 2011, a therapeutic intervention for Parkinson's disease. We're all very hopeful. We're, again, cautiously optimistic, and I think that the scientific community has taken a step back after we've seen some of the catastrophic things that have happened with earlier surgical interventions. So I go back and mention fetal cell transplant. That was just, everybody was starting to do it. There was a corner hospital in Los Angeles that was doing fetal cell transplantation in patients that hadn't even been treated with medications. Why? Because they could. And they charged, patients were taking second mortgages out. I mean, it was just horrific. And then a study was done in a controlled fashion, looking at a group of patients that had the real fetal cell transplant and a group of patients that had the surgical procedure without the fetal cells being injected. And what was found is that, in fact, the fetal cell, patients who received the fetal cell transplant, many of them did a lot worse. They developed runaway dyskinesias over time, where they had dyskinesias that were so bad, on no medication, they had to then go and have deep brain stimulation to treat that bad side effect from the surgical implantation. So the point is, if you run ahead and say, I've got a disease, I've got a human with a brain, let's go ahead and inject it or treat it. Before you understand the science, you can get into a lot of trouble. So I think we're moving ahead much more cautiously with interventions like stem cells, trying to understand the science so we, above all, do no harm. Okay? Thank you very much.